Hello everyone, this is a presentation on sudden unexpected infant deaths in Arizona from 2015 to 2019. A sudden unexpected infant death, or SUID, is when an infant less than 1 year dies and the cause of death was not apparent prior to the death investigation. Most SUIDs are due to suffocation and unsafe sleep environments. In Arizona, when an infant is suspected of dying from SUID, one of the 10 local child fatality reviews will complete a local review, and then a second level review will also occur by the subcommittees of the state CFR team, which is the child fatality review team. Information collected from these reviews is then entered into the National Center for Fatality Review and Prevention. The objective of this presentation is to analyze 5-year trends, to characterize SUIDs based on demographic, social, and risk factors, and to provide maternal and child health programs with information on SUID. As you can see on the first graph, SUID has remained relatively stable in Arizona. In 2015, it was between 1.9 deaths per 1,000 live births. It went up to 1 death per 1,000 live births, and again in 2019, it's back down to 0.9 deaths per live births. As you can also see, the unsafe sleep environment is similar to SUID, and suffocation is slightly lower. On the next graph, the combined SUID rates by race, you can see that African American or Black infants have a higher rate than the other 3 demographics: Hispanic, Latino, non-Hispanic white, and Asian and Pacific Islanders, and as well as American Indians or left infants. And both these demographics also have higher rates than the national combined rate, which is 0.97 deaths per 1,000 live births, and the Arizona combined rate, which is 0.87 deaths per 1,000 live births. As you can see on the map, Cochise, La Paz, and Mojave all have the higher rates, and Graham, Yuma, and Santa Cruz have the lower rates. Overall, the combined rates for urban is lower than the combined rates for rural counties. On the last bar graph, you can see that over the 5-year time period, that in 84% of the SUIDs, infants were in an unsafe sleep environment. Furthermore, in 55%, infants were not placed on their back, and 54% infants were bed sharing with another adult and or child. Overall, we recommend that there is continued education about the ABCs of sleeping, which means that infants should be alone on their backs or in a crib. And furthermore, we continue the education that nothing should be in the sleep environment, including toys, cushions, hanging cords, or any other item that would pose a potential risk for suffocation or strangulation. Thank you so much for listening to this presentation.